Welcome to the KPMG Connected, Powered, Trusted series for Knowledge 21. You'll hear how KPMG and ServiceNow are helping organizations rebuild businesses around the customer to create a borderless organization, where people and technology interact for new levels of productivity and generate business value at every stage of the journey. In this segment, we will explore the KPMG Connected Enterprise for Healthcare and share insights on what's needed to support successful digital transformation.
Hi, I'm Tim Williams. I'm a partner with KPMG's Healthcare Technology Practice. Joining me today are Lydia Lee from KPMG Canada and Drew Kerner from ServiceNow. Lydia, tell us a little bit about yourself.
Thanks, Tim. Hi, everybody. Lydia Lee, I'm a partner in KPMG Canada's Digital Healthcare Practice. I'm also the global co-lead for Connected Enterprise for Healthcare, which we'll talk about in a few minutes. And before I came to KPMG 4 years ago, I was the Chief Information Officer for a large academic health science center network in the Toronto area. So I've got over 25 years of digital healthcare experience.
Hey, I'm Drew Kerner. I'm the healthcare CTO here at ServiceNow. Been here just over 3 years and helping shape the vision and strategy as well as the product roadmap and direction as we build out our healthcare vertical. Previous to that, similar to Lydia, I worked at a hospital system here in Colorado for 10 years as well too, so I have that hands-on provider experience.
Thanks, Drew and Lydia. To begin, let's take a look at some of the factors that are driving the need for transformation. What are some of the big trends shaping healthcare today?
So I see two main things in my experience. One is the consumerization side from the patient experience aspect. So Amazon has really transformed the way that we interact with and to get information, and that one-click operation is something that consumers are looking for in other aspects of their life. So within healthcare, again, we want that one-click option to get our lab results, to get schedule an appointment, to look up a next appointment for our loved ones, and basically demanding some of that experience outside of the consumer world. And then second is around the transformation of the delivery of care. So COVID is forced rapid digital transformation, which we'll touch on in a second here. And a lot of those aspects of the patient care environment that shifted outside of the four walls with COVID are going to stay there. So delivering resilient care to that home health environment, as well as consumerizing that experience inside the four walls as well too, are going to be critical moving forward.
Yeah, I'd add a few other things. There's a couple of other big trends around workforce, the focus on analytics and integration. So we know that workforce resilience was an issue before COVID, and now with the pandemic, it's probably one of the most critical issues facing health systems. Here, for example, in some provinces in Canada, our ministries of health are actually considering redeployment of home care nurses into hospitals, given the staff shortages in acute care. So anything to support staff productivity and reduce the stress in the workplace is going to be huge. Regarding analytics, it used to be that healthcare organizations would implement systems first and figure out what to do with the data later. And the pivot now is that a base requirement for new solutions is that they have to prove how they support insight-led decisions at the workflow level, or they won't even be considered anymore. And then finally, we know that most health systems around the world are making a big shift to integrated care across the continuum to support things like population health management. And almost all of our healthcare clients are thinking about redesigning clinical workflows with their community partners and using digital solutions to connect patients with care teams across settings. So I'm sure this is going to continue to pick up momentum in the coming year.
Great, thanks for sharing those points of view. Let's discuss how each company approaches the healthcare market. Drew, let's start with ServiceNow.
So ServiceNow is always going to approach things from the workflow perspective, and specifically, how can we digitize unstructured workflows? In healthcare, we have a lot of manual processes that are ripe for that transformation. And if you look at things like an interoffice email or lots of still pagers within healthcare, or even still a lot of paper around, and you think of your a discharge process or a pre-admissions process, those are the types of things that we're looking to shave time and money off. An example that we launched with KPMG about a year and a half ago was the onboarding of clinicians. So that's a very manual process with serial and parallel approvals during that onboarding workflow.
You know, Drew, just kind of adding on to that, I think we all recognize that digital transformation for health systems is a really exciting but scary undertaking. There's a lot at stake to try and address some of those big trends that we were just talking about a few minutes ago. And For clients taking this challenge on, KPMG has developed a really good approach. It's called Connected Enterprise for Healthcare, or Connected Health for short, to help them break it down into bite-sized steps that really deliver results. The first step is to identify patient experiences that define and differentiate the health system strategies. So for example, how are patients going to directly access their health information? Or how can we ensure that services are accessible to patients? Or how are the care be coordinated across care settings? So these are experiences that need to get defined as distinct patient journeys that will ultimately drive workflow. The next step in this approach is to align the core clinical and business processes to support those patient experiences and strategies across the front, the middle, and the back office of a health system. So this is where digital enablement comes in, because we know that there's tons of room for automation, data integration, and creating insights to drive actions to support patients and providers. So the kind of things that Drew mentioned, and provider onboarding, for instance, is a great example of that. This focus on patient-centered process alignment is really why I think our approach working with ServiceNow is so complementary, because both of our firms recognize that this is really all about aligning workflow up, down, and across the health system to meet patients' needs.
And I think to add to that too, one thing I love about presenting and talking to Lydia is we both are always going to approach things from that patient lens. And our mission statement back at my hospital was world-class patient care, which we actually measured by being in the top 10%. And so that patient experience is critical. And the great thing about that connected methodology is, if you one of the tools that we use at ServiceNow is called a healthcare capability map, where the idea is we map all of the different aspects and workflows within that within a hospital environment. And then using that connected methodology, we can apply. We realize ServiceNow is going to be one of many technologies that's going to be applied, but making sure that they fit in the right spots during that process as well too. Because the last thing we want to do is apply technology that's cumbersome for the clinician during their process, because they already have no time to spend with their patients as it is. So, that's, I think, combining those two pieces together are a really good next step, as well as kind of mapping to that capability map I mentioned.
Great. So, this is a lot to think about for any organization. What advice do you have for customers that are tuning in? Where do they go from here?
Tim, I'd say that, beyond just defining the patient-centered strategies and then alignment of workflow, every health system also needs the right capabilities to deliver on these strategies. So Drew mentioned that ServiceNow looks at capabilities, and KPMG does as well. We actually did some really great research last year with Forrester's Consulting for looking at health systems around the world to understand what they're prioritizing and what capabilities are the most important to support their digital transformation. We've identified 8 specific areas that every health system needs to support their digital journey. So you can see those on the screen here. I won't go into all of these because Drew and I have already touched on a number of them, but there's 2 in particular that I've seen from client work already, where we probably are seeing the least level of maturity in some of these health system capabilities, and those are in seamless interactions and responsive operations and supply chain. Seamless interactions is all about the extent to which patients can transition easily between services or care settings with the least amount of friction possible. And we know that's a challenge in most health systems today within, for example, a hospital, let alone across a continuum of care. So that's an area of focus that many health systems need to really double down on. And then operations and supply chain, we've all seen how most health systems have really been tested during the pandemic in this area, wrangling PPE and medications. So there's a lot of work now, for instance, going on in back office transformation to mature in this capability area. So really putting it all together, Tim, is the exciting part. And we're seeing big payoffs from digital in terms of things like sustainable virtual care services, or integrated care with community and patient empowerment. And those are just some of the exciting changes that we're seeing happening.
And I think to add to that, the 8 steps are a great framework that Lydia mentioned. And I'm all about measuring that as part of the process too. So we leverage this concept of the digital transformation index, which, there's 4 categories during that process. And, most folks are in either stages 1 or 2. And the main thing is, what we want to do is measure the value that you're achieving as you go through these steps in the process, and make sure that, as you go through that digital transformation journey, that you're going to gain when in what we call business value assessment, and whether that's time or dollars or any other metric, we can actually measure that and at the end of the day, hopefully that's going to equate back to that patient experience.
Thank you. That's great information for those that are beginning to work on transforming their systems and processes and people for the future. Drew, Lydia, thank you very much. I really appreciate you participating in our conversation today.
Happy to be here. Thank you.
Thank you.
Thank you for joining us. We look forward to bringing you additional insights as we continue the ServiceNow Knowledge 21 digital experience. In the meantime, learn more by visiting us at visit.kpmg.us/knowledge.